Rehab simply is individuals that have an injury or illness, whether it be a stroke or spinal cord injury or head injury. They've had a serious injury that requires assistance to get them back to a level that they can go home and function in their normal daily lives and have a quality of life that's very important. And that's what we do. We provide those services. We provide the nursing services, the therapy services, our physicians provide the medical oversight, and we do it in an environment that is unparalleled in this region. Our facility and our staff, the quality of services that we give, with a caring and compassion that is unsurpassed. And when I say unsurpassed, the thing that means the most to me probably is I apply the golden rule. The golden rule is simply, that's my mom or my dad in that bed, or my son or daughter or my wife. How do I want them treated? And that's what we do consistently through all areas of this organization in treating our patients.
When patients are admitted to an acute hospital, they're usually admitted through the emergency room. My philosophy towards rehabilitation now is rehabilitation really should start in the emergency room, because it's fairly easy to identify patients when they are in the emergency room whether or not they're going to need rehabilitative care. Highlands Rehab has been very successful for many reasons. One, the physical facility is a very nice facility. All of the rooms are private. We have the ability of family members to sleep overnight. We have the ability of patients to be more independent in their room. We've had a staff that's been very solid here for many years, and the overall attitude is very upbeat, it's very proactive. It's very encouraging to patients that sometimes are quite depressed because they've had a change in their body status. And so our hope is that our rehabilitation team here, with physical therapy and occupational therapy, speech-language therapy, recreational therapy, pulmonary services, and social work, all of us work together. We have a nutrition therapist too, and a pharmacist that works on our team. And the team approach towards giving total care to the patient is very important to the patient's well-being, overall health, and of course their rehabilitative outcome.
The role of the nurse is to educate them and to meet their needs. So we look at the holistic approach, which is a whole system. We look at their mind and their body. So we look at their health issues as well as how they're adapting mentally to what's going on in their life right now.
We try and treat the whole patient so that we're looking at all aspects of their life and how it's impacting them emotionally, their recovery, their relationships with other people, how they're feeling about themselves.
Pero más importante que eso, la intención es fortalecer y ayudar al paciente a ser independiente aún con sus déficits. Enseñarle todos los trucos, enseñarle todo lo que es necesario y todo lo que está disponible para que él tenga una vida de calidad normal, para que él pueda ir y venir y hacer hasta donde pueda sin necesidad de ayuda de los demás.
I tell the patients when they come in and the family members, you're now part of our little family. We're a small little hospital, but you're part of the Highlands family.
I like the people. They're very friendly. They remember your name. The food is very good. I'm real picky with my food. And I know most of the people that originally started here at Highlands because I continue to come. And I like it so much I recommend it to all my friends and church members to come, and usually there's somebody I know in the facility here.
What we do is we try to track programs into things that cater to their specific problems. So, you know, if we have someone who comes in with a spinal cord injury, for example, we try to develop all of the orders, the programming, and the therapy, as well as long-term care into that area. So for acquired brain injury, we try to take specific care of those patient populations with some special programming that is available here and not available in other facilities designed for those patients. So for example, the spasticity management. A lot of times after head injuries or even strokes, you'll see people who have movement problems in the way that their hands contract and their legs contract. And this makes it difficult to do things like eat or brush your hair, makes it difficult to walk or move around, transfer from a bed to a wheelchair, or even take a shower. And there are certain medications and treatments that can increase that mobility in conjunction with therapy to make them better. We're one of the only facilities where we'll actually bring patients in from the community to address new issues with new types of technology. Another example of that would be the intrathecal baclofen pumps. In brain injury patients and spinal cord injury patients, like I had mentioned before, there are abnormal movements and tightness in muscles. These new technologies can help relax them, and it changes the way their body moves and works. And so it makes sense to bring them in for additional rehab to try to gain new goals. Sometimes you can take someone who couldn't walk and give them the ability to walk. Sometimes you can take someone who was not able to be alone for any period of time and needed constant supervision, to giving them the ability to be more independent and more alone for longer periods.
Many of the patients that we see sustain either injuries to their brain or to their spine, and they also tend to have combinations of injuries. I tend to see a blunt trauma population, which means these people are injured by either being in a car wreck, being struck by a car, or falling, or some type of industrial event. So they sustain injuries to not just maybe their bones, but to multiple organ systems, like the liver, the spleen, the lungs, the heart, as well as the brain and the spinal cord. So it's very important that we address all of those issues. Yes, it's one thing is I can have the orthopedic surgeons fix that patient's bones, but what about their head injury? They're going to need long-term recovery from that. And it's been shown that if you're very aggressive with rehabilitation from the time the patient gets to your critical care unit to the time they leave our doors to go to the rehabilitation hospital, you can enhance outcomes in getting these people back to society, back to their families sooner, and hopefully will have a long, productive life. Highlands Hospital does a great job because they take care of these patients day in and day out to help manage the more long-term effects of their trauma, to get these people back to where they need to be from a whole 100% standpoint, not just the event that I was involved in.
Highlands has been great, has been really great. Highlands is overall an awesome experience. I know I don't look like a person that was in an accident, but I could show you pictures, of my accident, and you'll be surprised. You'll probably say, wow, you survived, because that's what they told people who was helping. My parents were there where they were putting I have no memory of my accident, and my doctors recommended me not to go to accident. I shouldn't have been a survivor. So I know my speech is slurring, and I'm seeing a speech therapist, a neurologist for my head injury. So everything's been pretty good.
Our team approach is what really stands out for me anyways. We communicate with everybody. The therapy communicates very well with nursing communicates very well with therapy and the doctors. So we can basically provide the patient with a comprehensive treatment program.
He kind of just rounds with me and interacts with the patients. He's usually right next to me. He'll step up to the bed, and the patients will reach out and pet him. Generally, they interact with him before they ever interact with me. So he'll even go into the gym and go right up to their wheelchairs, and they just kind of touch him, interact with him, talk to him most of the time.
Stay. There you go.
Thank you.
I think for me personally, it's an environment where, it's not just the patients that you interact with, you're interacting with their families as well. And I think as a hospital, we know that we have to work together. At the end of the day, we're all trying to achieve the same goals, and we're trying to get that patient as strong as we can, as mobile as we can, as safely as we can. And I would say that we do a good job of working together. And just this week, a patient mentioned to me that we definitely portray that we have a cohesiveness, a unity, and I think that does come across to the patients, the fact that we support each other and we're able to provide good patient care and good customer service to them.